We're starting our session, second class of speaking, and in this class, we are going to discuss about the listening linguistic side that we have in the linguistic criteria. Yesterday, we discussed about the clinical skills. I hope that you would not be having any questions over here. So,
No, sir.
so basically, we can see that the first and foremost thing in the linguistic is fluency. So basically, what we can say is it's your natural flow of speech. A person is said to be a fluent one if he would be speaking with natural flow of speech, right? So the way you speak your natural language, you have to speak English as well as you want to be fluent. Then we should not have, let's say, hesitation or pauses. You should not have hesitation or pauses. Okay, and then we have the, we can say, grammar. In the grammar part, Uh, you can start with the tenses, maybe. Let's say we have first of all the range. So in range, we can have tenses, maybe present, maybe past, most of the time, and at time you can speak on the future as well. So then we have sentences and part of speech. And the second thing in the grammar is the accuracy, right? So you must be accurate with the range of grammar, right? So we have the second criteria in which we have the variety of grammar and you must be accurate, right? And third is the cohesive devices. What are uh, basically we have furthermore moreover in addition these are the cohesive devices, right? Then we have the pronunciation like intelligibility. Okay, what we have in the intelligibility is that you must have a clear pronunciation. Okay, you must have a clear pronunciation in the intelligibility part, right? You should have a understandable accent. You don't focus much on the accent, let's say. You must have a natural intonation, that is your highs and lows in the speaking. And you need to know, like, that I must pronounce the word appropriately, right? You should have ability to sound the word appropriately, right? This is in the intelligibility. Now we have the last part in the, you can say it's your basically the appropriateness, right? So in appropriateness, we need to know the language should be as per formality and the tone should be as per formality, right? You should speak in the layman language. No jargon should be used. So these are the linguistic criteria that we just discussed with you. So now I hope it's clear to you. So we will be discussing about today's card is the second encounter. Good news. versus bad news, right? We will discuss about two things. Either we have a good news, and either we have a bad news. Let's say if it's a good news or bad news, in any scenario, the patient will be coming to you with second time. So how would you start? As you remember that yesterday we discussed about in how would you start a conversation is your part. In case of good news, we can start with the tagging question, as we can start with the good news or bad news. We can start with the tagging question, but with high tone. Okay, let's say good morning, good afternoon, let's say. Then we can use tagging question. If I'm not wrong, today you are here to collect your, let's say, blood test report, your biopsy report, and so on. So you can see that this is a tagging question. We can start normally in the second encounter after greeting, after introducing maybe yourself, or even you can miss it. Good morning, Mr. Mark. Let's say, if I'm not wrong, today you're here to collect your blood test report, right? With high tone. Then we can have some background in any case. Let's say, okay, Mark, I can see from the file that previously you were having, let's say, blah blah issue. But I'm glad to tell you that your blood reports are quite normal. Then we can ask for patient expectation, what he think or she think. So in case of good news with greeting, hi, some background, right? And afterward, expectation, and then you have to tell the patient news. In this part, you can say your tone graph will be high. Like if I can plot it for you, like this is the greeting graph. Maybe you can see background, but it should be in this trend. Okay, so breaking bad news. Now we have breaking bad news. We would start with greeting, but with low tone. It should be quite low. Then is followed by tagging question, again with low tone. As you can see in the last card, when we were making good news, you can say that, Mr. Mark, if I'm not wrong, today you are here to collect your blood test report, right? With high tone. However, we can say that in this card, Mr. Mark, if I'm not wrong, today you are here to collect your blood test report, right? With low tone. Then we can move on toward the background. What will be the background? Okay, Mark, I have seen your file and I can understand that you are having bleeding from your back. So, and you also had a weight loss of blah kilogram, and you were having, let's say, blah blah issue. So, have you noticed any improvement? Okay, you need to ask the patient. Okay, then expectation. What do you think? What it could be? Past history of the patient, like, or past experience of such reports or handling with a medical report. Basically, these are the steps that you must have to follow till this point of any family member. Maybe chaperone, not as in a concept, but normally we call spouse or any other person. So we can see that breaking bad news, we have to greet, we have to tag, question with the background, with expectations, then past experience of handling such reports or medical reports. Then if you like to call someone your family member, right? So let's say we can again write it down, greeting. We can say tagging. Then we have a background, special expectation. Okay, past experience, family member, and then we have a teaser, then the news. So you can see that these are the steps that we are following. Teaser mean unfortunately I have some serious news. Then you break the news. So basically the tone graph will be in this trend. If I can plot the tone graph, it will be continuously in that declining trend. Now this is the breaking bad news, right? If this is not a terminal stage of cancer and there is a chance of recovery, so after that news, give him some time to the patient to react. According to his reaction, we can start, move on. But here, if you can see that you have break the news, give some time for pause, then raise. So here you can see that after breaking bad news, you have given the time to the patient. Then you have to assure the patient if it's not terminal stage, right? In high tone, bit high, energetic. Okay, and then whatever the task has to be followed. This is some steps that need to be followed in breaking bad news. Okay, so we'll be displaying one card in front of you now. So here we have the patient who was admitted with stroke, and we are discussing this thing with the parent regarding the electric machine privacy and its concern. So we can start with the normal greeting. Hello, my name is, let's say, Blanca or the nurse in this nursing home. I can understand that you must be son of Mr. Let's say Mark, who recently had stroke and now he has been recovering. If you have any question regarding his recovery or anything that is still point of concern for you, please feel free to ask me. Then the patient will ask you about the NG tube. You have to use the we can say layman language to explain the patient. You have to show the patient first of all, according to your concern, as you are concerned about the feeding tube, that let me show you that we are doing every protocol or procedure that must be appropriate for your father. So, if you allow me, I would like to discuss in detail that this is one of the safest method and why we can use the NG tube. First of all, it will help the patient as we are going to give him food via mouth. Sorry, we cannot give him food via mouth, so this tube will avoid choking. First of all, secondly, it will complete the dietary requirement of your father or the nutrition requirement of father. Okay, so have I made myself clear? Do you want to ask any question? Then you can move on to the next one. Then they will ask you about the lifting machine. You have to show the patient. Again, well, Mr. Mark, your concern is genuine, but let me show you that it's quite safe. It's much safer than the manual transfer. There are multiple benefits for that. To begin with, first and foremost, that it will improve the blood circulation. Number one. In addition to that, it will also help you, the patient to transfer from maybe bed to chair and from chair to shower and so on. So I believe that I addressed your concern of, you can say, uh, like lifting machine. Is there anything else that you want to ask? Then we have the privacy issue. Then you have to assure. Let me assure you that this is the standard operating protocol in our hospital that we have to maintain the privacy. Okay. And then at the end, you need to ask the patient again if he is following along, and then you have to summarize. Okay. So anyone? Second task that we'll be doing in class today. This is accident and emergency department. So you are here, and the patient was in the emergency department. His name is being mentioned. You no need to ask the name. There is something that is evident: head injury. mild concussion. He also had cuts and bruises that you can see. Swollen arm, clothes are torn, intoxicated, pain relief. Okay, then he want you to give the pain reliever. So we can start the card. Hello, my name is let's say blah blah. I'm the nurse in this section at emergency department center. What happened to you? I can see that there's some your clothes are torn and you are in bad shape. Is everything all right? You need to start the card in this approach, right? In this way, you can start the card. Oh, sorry to hear about your injuries. So you were saying that you had been in a fight and you got knocked down and like that. When the patient will tell you, then you can ask about do you remember if you had injured your head or somebody had hit at your head, and what you were doing at that time? Okay, so if you remember that somebody just have thrown some bottle, okay, and apart from the head and hand, is there any other part of your body that is being painful? Okay, basically, I'm a nurse, so it's not my job authority when he will ask you this question to prescribe you the painkiller. We have to wait for a doctor. Okay, then the patient will give you some tough time. Your concern is understandable. We don't know actually that the medication can have some side effects, and those effects can be exacerbated by alcohol, as you were drinking alcohol last night. So in that regard, we have to wait for a patient. So meanwhile, I will try to clean your you can say injuries, and we'll be helping hand over here. So like doctor will be there soon. Then you can discuss these things with him. Okay, the patient will be like giving you tough time in this card. So you have to consult the patient that you have to wait for a while. Doctor will be there soon, like that.